Welcome back to our show. I'm Dr. Kesty and I'm joined by my sister, Dr. Kesty. Today we're going to talk about around the mouth rejuvenation.
Great. Well, let's dive right into it. So the first thing that we can talk about is a myth that these lines around your mouth that some people called smoker's lines are due to smoking. I have so many people that come to me and say, I've never smoked a day in my life and I have these smoker's lines. Do people say that to you?
Mm-hmm.
And so I have to say they can't get worse if you smoke, just like all your skin quality can get worse if you smoke, and you can age faster if you do smoke or use tobacco products. But everyone gets lines around their mouth eventually. So they have nothing to do with smoking or health or anything like that. It's just the normal natural aging process, the sun damaging the collagen. So let's talk about how to treat them.
Yeah, it's definitely a myth. And what we're talking about is the vertical lines that form, above the upper lip, but also the lower lip. They're definitely from the sun damage. They can be from smoking. They're from the most dynamic movement. We're always talking, we're always, having so much movement in and around the mouth that those are going to create lines over time. Just like if you smile really big, you're going to make those crow's feet in and around your eyes. Over time, those are going to be more prominent. And that's where they're coming from is, all the movement, especially, sucking on a straw or something like that, where you're kind of making that more pursed lips. That's going to cause more lines in through there too.
So do you use straws?
Well, no, but that's just a personal preference.
Okay, so you don't not use straws because you're worried about the lines around your lips. You just don't like them.
Yeah, technically you could avoid them, but also you can't avoid talking. So you're going to have some kind of lines in and around your mouth. And what we're going to do is talk about how to get rid of them. So even if you have them or you love straws, we'll take.
I love straws. So I'm not giving up my straws.
Okay.
Tell me how to not get them.
Okay. So prevention purposes, number one is going to be, wrinkle relaxers. Again, just like the crow's feet in and around the eyes, we can do that in and around the mouth. What's that going to do? Basically, we're going after these vertical lines, especially on the top of the lip, to help decrease the amount of movement that you're getting.
So for someone who has kind of naturally fuller lips that you're not necessarily doing that lip flip for volume or surface area of the lips, how often would you do that on a patient just for wrinkle prevention?
Yeah, every 3 to 4 months usually, just like other wrinkle relaxers. And you bring up a different point, but also you are going to have a little bit more lateral show of your lips when we do that. So when you do a nice big smile, this isn't going to be as effective at pulling up. So you're going to show a little bit more lip, which is going to give you a little bit more volume, which, again, is not the worst thing in most people's opinion, but that's not the reason that we're doing it in this case. So.
Okay, great. Well, that's a great strategy. I love that strategy.
What's another strategy you use, Dr. Ketsu?
So I love lasers around the mouth. I think that it works really, really well to soften all of these wrinkles and really tighten up the skin around the mouth. You can get a really, really natural result by kind of tailoring the laser that you do towards the patient's cosmetic goals. If someone has never had laser before and is in their kind of late 60s or 70s and, has light hair, light eyes, lives in Florida like a lot of our patients, you're going to be doing more of a fully ablative laser on them because you want to get rid of, 80, 90% of those wrinkles in one session with about 7 to 14 days of downtime. For someone younger, it doesn't have necessarily as pronounced of wrinkles. You can do either a fully ablative laser, but just less energy, less heat getting delivered to the patient, or you can do a fractional laser, which has about 3 to 5 days downtime. You can either do that once or multiple times to treat kind of those wrinkles in your 30 or 40-year-old patient. So I like that lasers, you have a full spectrum of options to offer patients, either from, one session, 90, 95% removal of those wrinkles, all the way to, one fractional laser, maybe a year, just to treat teeny little wrinkles that are there and kind of prevent them from getting worse. So that's why I like lasers around the mouth. It's just such a customizable solution. I like to use erbium and CO2 for that, depending on the patient, kind of what their skin tone, what their goals are for that. And sometimes even a combination of both around the mouth can be really nice for patients.
Yeah, I agree with that. I think I also have a facet of my patients who don't have the downtime for 7 to 14 days, don't really want to have 90% of the, wrinkles removed, but they want some improvement in that collagen. And I think a more intensive fractional laser in 2 or 3 sessions I can actually make about a 50% improvement, which for most of my patients who are in their upper kind of 70s or upper 60s who just want to look refreshed, but not so much a clean slate, that's a really nice option for them too, because it's less downtime, it's less intensive as far as that. It's an easier pill to swallow, but also we're getting some really nice natural looking results. And again, we're going back to that kind of, you look like you are refreshed, but we're not kind of giving you that overdone look. So
Yeah, I completely agree with you. I love that about lasers that, we are able to have all lasers here in our clinic. We have so much fun taking great care of patients. And by that, what I really mean is customizing lasers for the patients, getting to know them, what their skin looks like, what their goals are, kind of what their downtime, what their lifestyle is, and kind of picking and choosing all these different lasers. And then even within the lasers, the settings. I mean, we're talking about settings all day, every day here for patients, because that's kind of really where the magic is to get those results for the patient in kind of the lifestyle that they have. So,
yeah, definitely.
okay, so let's talk about dermal filler around the mouth because some patients, they may not want a lip flip. Some patients, lasers just doesn't fit into their lifestyle. So tell me about how you use dermal filler to help them.
So, two things really. One, we tend to lose volume in the lip itself, which makes the lines in and around the mouth more prominent because instead of having a lip that's kind of protruding and you can kind of see all the redness of the lip, you start to see more of the lines in and around the mouth. So, the first option would be to fill the lips themselves. Now, I do that with rejuvenation and volume in through the bulk of the lip, but also around the rim to kind of help soften the lines in general that are kind of going all the way up to that red part of the lip. So that's option number one. And option number two would be to actually fine tooth comb through the tiny little wrinkles in and around the mouth. And that's filling each kind of vertical line, which is an option. I definitely use both of them in combination. I would be cautious about doing more of the filling in through the lips and be more on the reserve side as far as how much filler I'm using because migration and movement and just the kind of movement that we're having in and around the lips increases the risk of that going somewhere where we don't want it to be.
That's a good point. I think the thing that I like about lip filler now, or just by lip filler, I mean filler that you can use in the lips, around the lips, is there's such a wide variety of options for us now. When I was training, we had like two fillers that went in the lips, and now we have a bunch of them. So we're really able to choose exactly how robust of a filler do we want for this patient. Do they want just a little bit of subtle hydration, in which case we have fillers that are better for that? Do they want kind of volume and hydration? Do they just want volume? So I like having the full spectrum of different characteristics of the dermal filler. So we're able to kind of really make that custom match for the patient too, because it sounds like when you're injecting filler, you're injecting into the lips and or the lines. So you really want to have the specific filler that you feel like is the best for the patient for those kind of options.
Yeah, definitely. I mean, those would be two different types of filler for sure.
Thank you so much for listening to our episode about options for rejuvenation around the mouth. If you have any questions, please feel free to send us a DM or drop a comment on this video. And thank you so much for listening.
We'll see you next time.